Good evening, everyone, and thank you so much for joining us again tonight. If you are hearing my voice, then that means tonight is Monday night. It is 7 p.m. Eastern Standard Time, and you are ready for another PharmAssist virtual learning experience. Before we get started, I'd like to read this brief disclaimer that you see on your screen. That is, the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurse is the opinion of said nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And with all of that out of the way, I would like to introduce myself. My name is Craig Orpello, and I will be your host once again tonight. And as we mentioned, welcome to the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your very own home. As mentioned, this is every Monday night at 7 p.m. Eastern Standard Time. And tonight we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. How does the interactive part work? Well, that's where you come in. You can join us via either Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, whether through the chat section on Facebook, or if you're joining us via Zoom, you can type that right into the Q&A section or the chat. Either one will be picked up. As always, we are joined by various amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their clinic. And today, we are joined by Karen Hammond. So I want to thank all of you again for your time and interest this evening. Thank you, Karen, for joining us. And now I want to turn it over to Karen. Take it away, Karen.
Thank you so much, Craig. And thanks to all of y'all for joining us tonight. I see on the weather map that it's a pretty cold, snowy night up across parts of the country, especially up in the Northeast. I trust that you're all staying safe and warm. I'm really honored to be here tonight to talk with you about 3 products that we commonly prescribe. Those products are Menopur, Avidrel, and progesterone in oil. As Craig said, I am Karen Hammond. I am a women's health nurse practitioner with a doctoral degree, and I am the IVF program director at a private practice in Birmingham, Alabama. So I'm really amazed with the PharmAssist program. It's gone on now for several months, and I think it's just a really valuable tool for folks such as yourselves that are watching this tonight, or maybe even watching it later on just as a refresher. Back in the day, Jane Fonda had some workout videos that were on VHS, and people would watch the videos, and then when they were ready to exercise again, they would watch the videos and do it with her. So that might even be something you want to do when it's time for you to actually take the medications. You might just want to go to mymandelspharmacy.com/pharmacist and take a look at the videos, and we can even mix them together. Also, as Craig said, there are a number of us from around the country that are offering these videos all through Mandel's Pharmacy. And it's great just to get different perspectives. Maybe one of us can give you a little perk that the other didn't. So feel free to watch these. We are here for you and want this to be easy. And we want you to know that after watching a video or 2 and doing this once or twice yourself, you're going to be a pro. We want to walk through every step of the way. So always feel free to reach out to the folks at Mandel's Pharmacy or to your healthcare provider. But we'd like to offer you these videos just as a guide and some basic instruction. So we'll move on to talk about the very first product we're going to talk about, and it's called Menopur. Menopur is commonly called a gonadotropin, which is a hormone that's made by the brain that works directly on the ovaries to produce and grow eggs to get to be closer and closer to maturity. Menopur is a combination of 2 hormones, and those hormones are follicle stimulating hormone, FSH, and luteinizing hormone, LH. It's the only commercially available medication in this country that has both those hormones in it. So let's go ahead and Craig, if you'll cue up the video, we'll walk you through exactly how to do that. the injection. They're subcutaneous. We'll walk through those injections with this little video. And then on the other side, I'll be happy to answer questions that you have in particular. So take it away, Craig. I'd like to talk with you about administering Menopur. If your prescriber has recommended that you take Menopur, it's given subcutaneously, which means in the fatty part of your skin. You can either generally give it in your lower abdomen or in your outer thigh. It's quite easy to mix it. It does take a few steps though. You need to start by taking a look at what your dosage is. Each bottle of the powder of Menopur contains 75 international units. So if you have been prescribed 150 units, you will need 2 vials of the powder. No matter how many vials of powder you'll still just use 1 cc of the liquid. So I like to start by opening up the tops from all of the bottles. So we're going to do a demonstration today for 150 units. So you'll need again 2 powders, and you just lift the top up of the vial of both powders. It actually just lifts up really easily. And then lift off the top of one of the liquids. The liquids are just a way to dissolve the powder. There's no medication in here. It's important you use this liquid, but don't worry, you'll probably have some liquids left over. The next step is to take a Q cap. You may not have ever seen one of these before, but you just open up the package, and there's a little device that's in here that will just slip right onto the top of the ampule of the vial. So take the vial of liquid and just snap the Q cap right on top, just like that. Next, you'll take a syringe that will be provided with your medications, and it just screws right on top of the Q cap. Then the pretty cool part begins. Just draw back about a cc of liquid. If you get some air in there, that's okay. We'll have plenty of time to get that out. Once you get the liquid into the syringe, take off the syringe and the Q cap as 1 unit, and that has all of the liquid that you'll need. Next, you'll take the first vial of powder, attach the Q cap, squirt in all of the liquid, swirl it around a little bit, but it dissolves very quickly. Turn it upside down and withdraw that mixture. Now you have 75 units in the liquid in the syringe. Then take the Q cap and the syringe off as a single unit again, and put it on to the second powder. And it just snaps right on. Squirt in the liquid, swirl it around a little bit to make sure it's all dissolved, and then draw up that mixture. After that's in there, you have both of the ampules of powder, the vials of powder, in the syringe. Just unscrew it, and you're ready to put a needle on the top of it. And you can just take the tiny little needle right out of the package, and similarly, it'll just screw right on the tip of the syringe. And it's ready to give. When you give this injection, you might first want to take an alcohol pad and just swab the area that you want to give the injection. Then take the needle off, take the cup off the needle, bunch up the tissue, insert the needle straight in all the way, and then just push the medicine in. Release the plunger, wait a couple seconds, pull the needle straight out. If you need to, you can wipe the area with the alcohol prep and apply a bandage if you have a little bit of bleeding. But just like that, you've given your injection of Menopur. Perfect. How easy was that? Back when this product was first starting to be introduced in the U.S., the thing that patients I thought worried about initially was giving the injections, and that's what the manufacturer of the medication thought as well. And so I happened to be up at the home office for Ferring, the manufacturer for Menopur. And I said, really? I don't think people worry so much about doing the injection since it's such a tiny little needle, but they do worry about the science project of mixing it up. So that's when they came up after many iterations with the Q cap. So it actually just replaces having to use a big needle to draw up the medications and to do the mixing part before changing to a little needle. That way you have less to worry about it sticking yourself as you're doing this little mini science project. So I think it's a great medication. If your healthcare provider has recommended you take this, there are particular reasons for taking this brand. And always feel free to ask your provider why they've chosen this medication, and potentially if there are alternatives, if you have a particular reason for not being comfortable with it. But it's really easy. After you do one, you can sit in the waiting room and teach other patients. So Craig, can I turn it back to you to see if there are any questions for me?
Yes, absolutely. All right. Thank you so much. It's great to see you. All right. So let's get started with some of these questions coming in. As mentioned before, you can put any of those questions into either the Facebook chat, or if you are joining us via Zoom, you can just type right into the chat there, also the Q&A section, and questions will be answered through either method. So this one just popped up. So let's see. It says, do you prefer for patients to put this injection into the stomach or the hip?
Great question. Really, this medication is to be administered most commonly subcutaneously, although some people give it in the muscle of the hip. I recommend to my patients to take it in their belly. Most women, the way God made us, we just have a little bit of extra adipose on our belly. So it's easy to find a place that we can pinch and itch to get the medicine. But I think it's the least discomfort in your belly. If there are bruises, it's easy to get a bruise anytime you put a needle in you. It doesn't mean you did something wrong, just in case you get a little redness or bruise there. But that's a place that most people don't show, especially this time of the year. So it's fine to take it in your belly. It's fine to take it in your hip. Wherever you can pinch an inch, kind of out to the side would probably be best. Or you can even take it back in the back of your arm, just pinch an inch up and put the needle in there. Might be a little bit more of a challenge for you to give it to yourself there. Perhaps a friend or your partner could do it. You can also lie your arm down against a work surface if you do need to give it to yourself. And that way it'll kind of flatten up to give a little bit of a fatty area to give it. And that way you can just push the needle straight in to give it. It's a simple injection. As long as it's given subcutaneously, that's perfectly fine. I generally recommend the belly, as I said, just for comfort and convenience, but also it's fine to do it in your arm, the fatty part of your hip, or your outer part of your thigh.
Perfect. Thank you very much. I appreciate it, because I think sometimes we're having, very specific questions around where should I inject it, or those types of questions like we just had. And then on the other hand, we get the much more broad kind of generalized questions like this one that you've answered many other times on the show before. And that question is, how does Menopur actually work? Do you use it in place of FSH or alongside it? And I know you touched a little bit about that on your, kind of before the prologue, before we played it, but just a little bit more information would be great. Thank you.
Sure. So the medication protocol are generally very specific for each patient. Some providers have preferred protocols or specific protocols based on your particular health indications. As I said earlier, the difference in taking Menopur and the other gonadotropin preparations that are commercially available in this country and manufactured here is the addition of LH. The other medications like Gonal-F and Follistim are just FSH. Scientifically speaking, I guess I could say the times that you need LH the most are generally if you're very thin, meaning underweight, a BMI, I think of probably it's less than 25, but certainly if it's less than 20, you may benefit from LH. Also, if you have don't have periods at all, because you exercise a lot and have exercise-induced amenorrhea, it's called. That would be a time that your body's probably not making enough LH. Another time is when you are taking medications like Lupron or Cetrotide or Ganirelix. Some people feel strongly it needs to be added if the LH is suppressed by these other medicines. Certain dosage, higher dosages of Lupron can make a difference if you take it every day, or if you are some people believe that it should be added in if you are taking Cetrotide or Ganirelix. Those are things that you should ask your provider about. And it never hurts our feelings when people ask us why we're prescribing specific medications and to be taken in a specific way. We want what's best for you. And I love it when my patients ask me questions like that. Shows that they're informed consumers and they really want to figure this out, whether you're journaling or just have a particular interest in knowing for that time.
That's great. No, and I think that's one of the huge benefits of the PharmAssist program, is allowing that outlet for people to ask these questions. Sometimes it may be something that you are maybe not comfortable at the time asking in front of your physician, although we obviously recommend, just to Karen's point, that you ask as many questions as you can, because typically your physician or your nurse loves that. They want to be able, they know that you're interested in that. That really helps with the process. But sometimes it could be because you just don't think about it until after. And so that's the point of these programs, is to share that information with you. So great that you were able to answer that. And one thing I will just say, I mean, one thing that I've never had a problem with, and never had a conversation during quarantine or now with being snowed in, about having a chronically low BMI. So that's interesting. Great that you brought that up, because I've never had to have that conversation. So awesome. Let's see, moving on. We have another question here. So this comes in pretty often with Menopur as well. Actually comes in with a lot of the different products. But this is around just the idea of potentially making a mistake with a shot. And so specifically, this question is my cycle going to be ruined if I miss one of my shots of Menopur completely?
That's a great question. And we do have lives outside of infertility. And we want you to have a life outside of infertility. This should be one small aspect your treatment should be of your life. And I love it when people go about their business and they say, oh, yes, I've got an appointment, or oh, yes, I need to take an injection. By and large, these medicines are quite forgiving. Different protocols tell us to do different things. Some people give medicines every other day. And so that tells us right there, it's probably not going to mess you up if you forget an injection. It's interesting. I had a patient who came in to see me today, and I had prescribed her to do a specific protocol, which I call sequential letrozole and gonadotropins. And they take the letrozole for 5 days and overlap it for 2 or 3 days with a gonadotropin, either FSH or HMG like Menopur. And then they do that for 2 or 3 days, and then they just take the gonadotropin for a couple of days. Well, she was so detail oriented to get everything right, but she didn't read past the overlap. And so she missed taking her injections on Saturday and Sunday. So she had only taken 3 injections. She should have taken 5. And when I talked to her, I said, no, you should have enough medicine to take for another day. And she said, oh, I've got lots of medicine. I thought, okay, let me look and see what I wrote for you. And come to find out, she'd just missed those 2 days. But fortunately, her follicles continued to grow, and she did just fine. And she's going to have her egg retrieval on Thursday. So while I don't advocate for missing dosages, sometimes it can work out just fine. Once you've realized you've missed a dose, just give your healthcare provider a call, let them know what happened, and they'll make any kind of necessary adjustments that they think are best for you.
Yeah, and that's, I think, one thing that comes up almost every single show, and it's worth reiterating that idea that you're never going to be alone in a situation where it's the first time it's ever happened, or that the doctor or your nurse has never seen this situation before. So it's always good to feel that you can reach out and ask those questions, and know that the sooner you ask those questions, the better you're able to respond to the situation. But it's not the first time it's happened. They've definitely seen and they've dealt with it before and figured it out. And hopefully the goal of this program is you get those questions out of the way now so you understand how it works, so that you won't have those problems later on. You kind of get the jitters out in the question so that it doesn't come out in your action. And that's really part of what we're trying to do here. So hopefully that helps. Thank you for that great question. And another question that comes in, and this one is a little bit more about side effects, which comes up quite often as well. It's always a question people have are, yeah, great. Okay, how it works, that's all that stuff's great, but how's it going to impact me? How's it going to mess with my daily life? And that's great. We're glad to have those questions. So this one says, what common side effects are caused by Menopur? Are there any tricks that you can offer to try to prevent them in advance, or ways to treat them after the fact?
Great question. You know, anytime we're using some kind of ovarian stimulant, ovulation induction agent like Menopur or Gonal-f or Follistim, it makes the ovaries grow. And sometimes they can grow quickly, and that can make you feel heavy or bloated. And sometimes after you ovulate or after you have your egg retrieval, when the follicle is either drained or breaks open for the event of ovulation, the leftover sac that they were in refills with a little blood and some other fluids, and that can cause some degree of hyperstimulation. In fact, many people call the ovulation induction part, the ovarian stimulation part, controlled ovarian hyperstimulation. We're wanting to get more than one egg if we can. So be aware of that, that you may experience that. Your healthcare providers are going to watch that carefully, watch your ovarian response with ultrasounds and perhaps blood tests to minimize the likelihood of that happening. And there are some medical tricks that we can always use to try to mitigate that. Other common things that I hear people say, you know, it's often the first shot that they give. They ask if it's going to hurt, if it's going to sting, should I push it fast or slow? Some people say that it might sting just a little bit. Actually, when you get an injection, it's not the needle that is uncomfortable, no matter what the medication is. It's the medicine going in that may cause a little bit of discomfort. Mild stinging is really the only discomfort that can happen with the Menopur. Things that I recommend for that are just to take a deep breath, breathe in deeply as you put the needle in, and as you push the medicine in, blow it out really slowly. I tell people to breathe deeply through their nose and blow out slowly through their mouths. And it goes in so thin, it goes in really quickly, that you'll have it completely injected by the time you blow out that one breath. Your providers, as I said, will watch you closely to help you with any concerns that you may have. Occasionally you can have a little bruising. It doesn't matter if I give you the injection or your, somebody else in your office, your friend, your spouse, whoever gives it to you, you can always nick a little vessel and have like a little bruising or maybe a little drop of blood come out. Sometimes you might see a little drop of medication come out. Those things are all normal and no cause for alarm. For patients that do experience a little burning or stinging at the time of injection, it goes away just as quickly as it started. Craig?
Perfect. Thank you so much. That was a very comprehensive answer to a question that a lot of people have. And so it's helpful to know in advance. A lot of times just being aware of what some of those side effects might be, just in general, make them less of an issue for you, because you realize it's not as big an issue. It's something that you can easily overcome or that you can treat. And so it really just helps that kind of knowing what's going to come can help you prepare with the situation. So great question. Great answer. Thank you so much, Karen. And with that being said, it looks to be that we're all caught up with questions so far on Menopur. As always, what we like to do is we like to give about 30 seconds or so. If somebody is, if you just heard that last answer and it made you think of a question and you're furiously trying to type it into your iPhone, no problem. We will give you about 30 more seconds. And Karen, I'll throw it over to you if you have anything that you want to share in the meantime as we get ready to transition to the next product.
Sounds great. So if you have been prescribed Menopur, just sit back and relax and know that after one injection, probably even before that one injection, you're going to be a pro at it. Just follow the instructions that your provider gives you. You've always got backup from Mandel's to help you with any of these medications or the injections. So don't fret about it at all. It just takes a second to give the injection. So if you hate needles and you're dreading this, don't worry at all, because it goes away so quickly. In fact, most of my patients give their own injections. If you're a little squeamish about that, that's okay too. It's fine to get somebody else to give it to you. And we'll be happy to show any of y'all how, or you can have them watch these videos too. Did we get any other questions, Craig?
Nope, I think we're all caught up. So we are ready to move on to the next product whenever you are. One quick thing, we always like to let everyone know that don't worry, it's not like once we move on, we're just going to ignore any questions about earlier products. If you think of something later, at any point in time, you can ask those questions, and Karen will get to them throughout the course of the program. So no rush, just sit back and get ready for the next product, and you can ask your questions whenever you're ready. Over to you.
Perfect. Thank you. So the next product that I'm going to talk to you about tonight is called Avidrel. And Avidrel is a recombinant, or kind of laboratory created HCG. HCG mimics the LH surge, and that's the hormone that kind of induces ovulation, causes the final maturation of the eggs and the egg to be released from each follicle. So this medication is pre-mixed, it's given sub-Q, and it's probably the easiest injection that you'll ever give. So Craig, if you'll cue up the video, and we'll take a look at exactly how to do it, and then I can answer some questions on the other side. I'd like to talk to you about administering Avidrel. If your prescriber has recommended you take Avidrel, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Avidrel comes in a little package like this, and you simply open it up and remove the inside part like that. Fortunately, with this medicine, it's in a pre-filled syringe, so the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two, and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Avidrel. Gosh, that's such an easy injection. It'd be nice if they all came like that. In fact, many of the others are pretty simple like that too. So Avidrel will most likely be ordered for you to take, or recommended for you to take at a very specific time. Usually procedures are scheduled about 34 to 36 hours after you take the medicine that does that final maturing of your eggs, and will release them if more time passes. So we want to get there. If you're doing IVF or even an insemination, we want to be able to retrieve the eggs or have the sperm in the right place just at the right time. So you'll be given a particular time to do it. One thing that I noticed when I was watching this video with you is that I talked about bunching up the skin when you give the injection. So some people think, well, that's the way they do it on TV. You should bunch up the skin with all the injections. Actually, you want to give this medication as well as the Minipure in fatty tissue. So that's why you bunch it up, to make sure that when you put that needle all the way in, the needle is still going into fat. With intramuscular injections, you want to separate the tissue. So when you put the needle all the way in, it's more likely to go into muscle. So keep that in mind as you're watching the videos. Subcutaneous, you pinch; intramuscular, you separate. So Craig, let's open it up for some questions and see what we've got.
So as we just mentioned, actually, the fact that we don't cut off questions from the earlier products, the first question coming in is actually a follow-up to a question from earlier regarding Menopur. So we can just jump over to that. We were talking about the different locations where you can give the shot and the different places where you recommend to, kind of shifting around so that it doesn't cause pain in a single site. And the question came in, is it recommended, or do you specifically recommend that you switch sides? Like, do you alternate sides with the shot, or do you just rotate as need be? Kind of how do you figure out when to move from location to location?
Oh, that's a great question. Since the subcutaneous injections can be given so many different places, I tell people if they prefer to give it in their abdomen, which most women I find do, they can switch sides, but you can actually go all around the belly button and out to the side a little bit. Wherever you can pinch an inch and you're pinching into fatty tissue, you can give it anywhere like that. So sometimes people switch sides. Some people do it like going around a clock, but I would try not to go in the exact same place, just because that may be a little bit tender if you put a needle in the exact same place. I also have patients that are taking Menopur and another ovarian stimulant like Gonal-F or Follistim. And if that's the case, people usually do one on one side and one on the other. It's very forgiving. So you can use your own judgment and see what you feel most comfortable with. Great question.
All right, perfect. So now onto an Avidril question that came in. And so we'll see. This one is a little bit, we talked about the final question at the end about side effects with Menopur. This question comes in saying, what are the major side effects associated with Avidril? Are there ways to prevent them in advance or ways to treat them after the fact?
Okay. Avidril itself doesn't really have any side effects, except for, the potential anytime you put a needle in you that it could be uncomfortable, or it could bleed or leave a little bruise. But the effects of the other medicines you've taken before you take the Avidril that have stimulated your ovaries, that's what can cause the side effects of the ovarian hyperstimulation, like we talked about previously. I wouldn't worry at all about side effects of this particular medication, because it's actually the event of ovulation and the aftermath of ovulation that could potentially cause some discomfort and maybe ovarian hyperstimulation. Interesting, this is a fairly low dose of HCG. It's equivalent to about 5,000 units of traditional HCG that we use. So most people are apt to have less side effects with taking a lower amount of the medication as opposed to the traditional 10,000 units of HCG that many people were trained to prescribe, such as myself, and still do prescribe. What other questions do we have?
All right, perfect. A couple more coming in. And I just also want to just say very briefly, we apologize. I noticed, or I saw, that there are some issues with the Facebook broadcast. I hope that's not happening to everybody, but if it is, I apologize, and I hope things are back on course now and we're ready to go. But we will plug along on our end, Karen, and make sure that we get this done, and then we will make sure that we get this onto the on demand, so that if you are missing any parts here, any answers to the questions that you were not able to get, you'll have the live full broadcast to be able to utilize to go back and check anything you may have missed. So apologize for the technical difficulties. As anything live and anything internet, there's always these risks. So sorry about that. Moving on, let's see some other questions coming in. All right, so why would someone use Avidril over the other forms of HCG that are out there? Are there any specific benefits, or is it just dealer's choice?
Great question. And it is a little bit of a dealer's choice. There are a few reasons to choose Avidril, and I think there are a few reasons maybe to choose another formulation. As you could see from the demo video that Craig showed, it's really, really easy to do. There's no mixing, there's no changing needles, there's no drawing up fluid. There's no figuring out which needle to put on the syringe to give the injection because everything is already done. So it's very simple. But as I said earlier, the Avidrel is equivalent to 5,000 units of the other formulation of HCG. Some people believe that you may need more than 5,000 units, although others can argue that you probably don't even need 5,000 units. So your individual prescriber will help you decide which is best for you. If you're going to take a higher dosage, then it's going to be more cost effective and easier to actually do as a single injection to use a different formulation of HCG. Sometimes insurance pays for one and not the other. Cost is always a factor, and as a healthcare provider, I always try to be sensitive to what the cost of these medications are. And the folks at Mandel's can help you with that too, knowing what's the cost-effective medication for you. Now, if your healthcare provider recommends that you take Avidrel or another HCG, and you say, "Oh, but it costs one or the other costs more. Can I change to the other?" You can ask about that at Mandel's, but it's going to take a different prescription. So I would recommend that you talk with your healthcare provider and ask specifically about that. We're always happy to answer those questions, and your provider or one of our assistants are happy to help you get the most effective, both medically and financially, most effective medication for you and for your specific needs. Great questions.
And that's actually a perfect time just to mention that we at Mandel's, we do work together with your HCP, with both the physician, all the nurses there, and with you to make sure that you get all those answers that you need. We have an entire financial team that we can work with. We work with the clinic to make sure that we can determine the difference between, like we said, if it's just dealer's choice and it's just, hey, this is the one I just happened to jot down, but there's another one that's that is a cheaper option for you or a covered option for you based on your insurance. We will definitely work with your clinician and your nurse and you as well to make sure we get that, versus situations where there's an actual reason why one was prescribed versus the other, and we'll make sure that we can work with that as well. So one of the benefits of working with Mandel's and that how close we partner with our clinics is to make sure that we can get you those answers and get you the most effective and cost-effective medication that you can use. So great question, and thanks for bringing that up because it allowed me to slide in there with that little commercial there. So let's move on to the next question. So now we talked about missing shots earlier when we talked about the Menopur and kind of the amount of time you're going to be on it and the risk of missing one and reaching out to your clinic and talking and figuring that out. This one's a little bit different, and it says, how specific is the injection time for Avidrel? What window of time do I have before I need to contact my nurse?
Gosh, that is a great question. And I've done this for soon to be 37 years. And believe me, I have seen people, I think I've heard it all, but I still get surprises once in a while. The Avidrel or HCG is the medication that is most important you take at a particular time. That being said, it's still a little bit forgiving. If it's off by a few minutes, I wouldn't fret over it at all. In fact, here's a little secret about me. Sometimes I have to have patients take their HCG at midnight, and I always get confused, and I'm afraid patients will be confused. Is that tonight or tomorrow if you're going to take it at midnight? So I'll usually say 11:59. That way I know for sure it's PM. Or it's just a simple little thing, but I want everything to be as easy and as understandable for my patients and myself alike. Now, I really don't expect anybody to be setting their alarm and watching the second hand on their clock so they can put the needle in at exactly 11:59 p.m. If it varies, like I said, by just a few minutes, that is perfectly fine. Where it gets to be a little bit of an issue is if you sleep through the alarm clock and you're going to be off by 5 or 6 or 7 hours. That actually can make a difference. And that warrants a call to your healthcare provider when it happens. Like I said, the Avidrel or HCG does the final maturation of the eggs. And if you don't have that at least a certain number of hours, and most people think it's probably at least 34 hours, then it may need to adjust the time of your insemination or your IVF egg retrieval. So if you're off by more, if you're off by more than, I would say 30 minutes, I think it's appropriate to call your healthcare provider. There's always a little bit of wiggle room. That's why I say 30 minutes or so, because not every IVF team is right on time when it's time for the retrieval. And we don't start to worry about it unless you're an hour or maybe even 2 hours behind with it. Nevertheless, that is a question I would want my patients to reach out to me about, and I would recommend that you reach out to your provider about. Also, I've had patients to, I would say, take your HCG at this time. Tonight, we'll do your retrieval day after tomorrow in the morning. And they get home and they're thinking about doing it. And they think, gosh, surely she didn't mean for a whole 35 hours to go by. So I'm going to wait and take this tomorrow. I don't want to ovulate too soon. In that case, and I've seen it happen a few times, we end up having to delay the retrieval by a day. So timing is very important with this medication. And it doesn't matter if it's Avidrel or any other kind of HCG. It's very important you take it at the time that it was prescribed. So do your best. We know mistakes happen. We're on behalf of other presiders and myself, we're happy to try to work with you as best we can to accommodate for that. I can tell you that I have done retrievals before at 10 o'clock at night. When patients took their HCG at 9 in the morning instead of 9 at night. Sometimes people are able to work with you on things like that, and sometimes they can't. So of all the injections, this I think is the least apt to be more flexible. Other questions?
Yes, thank you very much. And one quick thing, Karen, I just did want to let you know that in the middle of while you were answering, it seems, at least it seems to me, and I'm not 100% sure, but it looks like the Facebook broadcast did cut off because of whatever the issue was happening. But I was able to get it back up and running. It is going right now. I cannot guarantee that unless we know somebody that can give Mark Zuckerberg a call. I'm not sure exactly how long it's going to last, but we're going to go through it. And like I said, the beauty of, for anybody who's listening to this, just so you know, all this is being recorded and will be put up for on-demand viewing. So if for some reason something, you got kicked off and you come back on and you missed a little bit in the middle there, we will have the whole thing from beginning to end, and you can just go to the sections that you missed and see those answers. So just want to thank everybody for being a good sport and working with us as we, go through the internet mixed with weather issues. Who knows, maybe something is collapsing over here on my end. So I apologize for that. But with all that being said, we can move on to another question that comes in that said, and you've talked about, you were talking about a lot about the contacting your nurse and reaching out and what the window is of different options. And one of the things here, I guess, is people, this question comes up quite a bit, but I guess a lot of times people want to prepare for the potential that they might miss their shot with Avidrel. So what options specifically are on the table? And I know you obviously touched on some of that stuff, but it just says here, when I contact the nurse, what specific options do I have if I'm not just a little bit delayed and I call up and we say, hey, we can move things around. But like you mentioned, the situation where it's like, I slept right through it and, missed it altogether. What options do I have other than potentially just saying, I guess I just threw away all that money?
Well, great question. And when I tell somebody when to take HCG, I usually say it 2 or 3 or 4 times. I write it down. I ask the patient to put an alarm in her phone, do whatever we can to maximize the likelihood it'll be taken on time. Nevertheless, it happens. We do sleep through the alarms. The power goes out or a snowstorm comes. Anything can happen that can keep us from being able to adhere as strictly as we'd like to. A little bit, and I hate to say it, but a little bit, you're going to be at the mercy of the program that's treating you. They may have lots of patients scheduled, and it may be tough to juggle trying to get you in just at the right time that you need. And it is possible, if you miss it, that your cycle could be canceled. If your tubes are open, maybe they can change it to doing something other than IVF if that's what's been recommended for you. But it's a tough thing to tell somebody that there can't be much flexibility. Unfortunately, sometimes that's the case. I know in our program and gosh, probably every other program I know, we want you to make it through your complete cycle, and we want you to be pregnant just like you do. And we will try to do the best we can with it. I've had some people take it 48 hours at 48 hours instead of the 35 or 36 that most people recommend. If you do that and then you come in, you will have ovulated. So we would have missed it altogether. And there's not really anything that can be done. The best thing you can do is to talk to your provider if you realize that you've made a mistake. Whether you forgot, whether your alarm didn't go off, or whether you just miscalculated or misunderstood or thought something other than what you told you might be best. Just be upfront and honest with your provider so we can figure out how we can rectify the situation, and if there is something that we can do to make it possible for you to still undergo your treatment. So when you recognize there's a problem, better sooner than later. It's something that if you've taken it way too early, you don't want to try to have an egg retrieval and not get anything. And if you've not taken it, if you've taken it too late, then that final maturing of the egg may not have happened, and the eggs will adhere to the wall of each follicle. So we may not get any eggs from doing that. So do your very, very best to try to make sure you take it just at the right time. Set an alarm and a backup alarm, and have a friend call you, or do whatever you can to have double checks and triple checks. I've actually seen a handful of patients in my career that I thought, oh, I'm just afraid they're not going to do it, or I would think about them just at the right time. So I'd call them up and say, I just want to make sure you're doing your injection. So it really is just that important that you take it as close to the prescribed time as absolutely possible. Craig?
That's some pretty outstanding service there, customer service. You get an actual phone call saying, hey, just calling to remind you that you got to get a shot. And while not everyone can guarantee that you'll have that type of service, we always talk about in 2021, the number of options we have and ways to remind ourselves of things, whether it is, another person, a friend, a partner, something like that, family member, or the myriad of electronic personal like assistants that we have spread around our house that you can just shout out and say, set an alarm for such and such time. You can set an alarm on your watch, all these different things. So we always recommend that you probably utilize as many of those as you think are necessary to make sure that you'll remember. If one is not enough, keep going until you feel comfortable, but it's definitely worthwhile. And you can put those things to good use for once, instead of just asking them to play a song or ask what the weather's like or something like that. So good answer. Thank you so much, Karen. And with that being said, it looks like we are all caught up with questions. I'm just quickly glancing to see, and it looks like we're all good with questions on Avidril. So again, as always, we'll give another like 30 seconds or so. So I'll throw it back over to you, Karen, if there's anything else you want to share in the meantime. And then if we're all wrapped up there, we can head on to the third and final product of the night.
Perfect. So the other thing I'd like to share with y'all about Avidril or any other HCG, and really all of your medicines, is as soon as you get your box through FedEx at your address, one of the things that I think you should do first is to look at all of your medicine. Make sure you have everything there. Mandel's is awesome about making sure that you do get all of your medicines, but sometimes you might think you have an inventory of stuff at home and you say, oh, well, don't send this or don't send that. If you have medication that you have from a previous cycle, or that somebody gave you, or that's just sitting in wherever you keep all of your medications, for the HCG, open it up and make sure both the liquid and the powder are in there. Or for the Avidril, it's going to be in the fridge. You want to open that up and make sure that it has not been used. I have had a few, probably more than a few, patients call me in the middle of the night when it's time for them to take their HCG, and they realize, gosh, I had this from when I was just taking medicines to help me ovulate. Now I'm doing IVF, and the only thing that's in there is a partially used bottle of the liquid. To find HCG in the middle of the night is a tall order. I know I have called the folks at Mandel's previously in the middle of the night to say, help me get this. Can you give me any idea? I need to get this as soon as possible. Sometimes it delays a cycle if you don't have it already, or it can cancel a cycle. Now I try to keep at least a bottle of it in my office, just so I can make sure if somebody does call me, I will have some as an emergency use. But just make sure that you do in fact have all the medicines you need for the cycle, especially the HCG, since that one is so important you take it at that particular time. So any other questions?
It looks like we are all good to go. We're all caught up. As always, obviously, we'll have time at the end for anybody who has any stragglers that have last minute questions that you want to bring up for us. But in the meantime, I think we're all ready to move on to the third and final product. So over to you, Karen.
Okie doke. So the next product, my third and final product of the evening to talk to you about, is progesterone and oil, PIO. So it's interesting whenever I say, yeah, you'll do progesterone and oil, people kind of fret a little bit about it and think, oh my goodness, and progesterone and progesterone shots. And you've heard horror stories about it and get really nervous. It's an 1.5 inch long needle, and you think that's really got to go into the muscle and into me, and people worry about it a lot. But actually, if you follow these instructions, you are going to be absolutely amazed how easy it is to give this injection. So as Craig cues up the video, just keep in mind, use this as a resource when it's time for you to take this injection, so you can watch it again and get these little tips for how to do the injection, and it cause minimal discomfort and minimal problems. So you can go ahead and start that video. Your healthcare provider has recommended that you take progesterone and oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone and oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil, and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all, and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol, but with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams. So we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to one line or two to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it. Just one time. We know you're already clean. Just wipe it one time. Separate the tissue. Remove the top from the needle. Put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil. So that wasn't so scary, was it? I think the thought of it is the worst part. The dread, the not knowing what to expect, and the fact that people kind of trash talk it a little bit. But it's not nearly as bad as you think it might be. So I'll start out as you think of questions that you might have. Something that people ask me not infrequently is, why would I prescribe progesterone and oil over a vaginal preparation or a pill? Why does it have to be a shot? Because you know that progesterone can be given in a number of different ways. Well, it's really all about absorption. I and others believe, and it's been clinically shown, that progesterone and oil may actually provide better absorption for progesterone, and it may help to hold on to a pregnancy. In my practice, I do a lot of Invacel, which is the little intravaginal culture, and you can't really, once the Invacel's in, there's not really room to put anything else. So it's IM progesterone for my patients. Not too many people use oral progesterone for luteal support or to help supply extra progesterone to sustain a pregnancy. There are other vaginal preparations that are available, but I believe that this is the one that that works the best. So, and is best absorbed. If you have real concerns about this, talk to your healthcare provider. Maybe it was, as Craig said earlier, just a luck of the draw that they said to do progesterone and oil over another type formulation. So you can always discuss, ask questions, and ask your nurse for other tips and tricks that she might have. It's interesting how we can all come up with different little things we've seen work along the way. One of the things I like to do is have a patient actually stand up when she gets the injection as opposed to lie down. And if you stand up for the injection, just take the weight off of the leg that you're going to, the side that you're going to give it in. Just kind of lift up your leg a little bit, and that relaxes your hip muscle. So it's not tense when the needle is put in. I think for most people, they want a friend or family member to give the injections, but I have lots of women who give their own progesterone injections, either by looking in the mirror, I'm probably not that coordinated, or just looking around and saying, okay, that's where it goes. Most of the time, I will draw a target on my patient's hips before they leave on the day of or the day before they start their progesterone. So the husband can be, or friend or partner, whoever, can be really good at hitting that target. And patients that give their own injections say, if they've got that circle drawn on their hips, they know right where to put it. And if they see the needles go in there, they feel comfortable with it. So Craig, let me turn it back to you and see what questions folks are asking.
Perfect. All right. So a couple are coming in, and as they always are typically with progesterone and oil, this is one of the ones where we expect it to come in. And so this one is just a pretty basic. I mean, you touched on this already, but in light of how much difficulty, quote unquote, they said I've heard around this product, why is progesterone and oil such a necessary part of my cycle? Why can't I just go without it?
That's a great question. It's always good to know why we're telling you to take these different medicines that we're prescribing. So the reason progesterone is important, I'm going to use it in the context of IVF. When you have your eggs retrieved for IVF, your provider will not just take the eggs out of the developing follicle, but also take all of the follicle fluid out of the developing follicles. And that follicle fluid may be important in developing the corpus luteum. And that's the cyst that naturally occurs after you ovulate that makes progesterone. That's the source of progesterone that your body makes. So if your body may not make progesterone well, then it's important that it be supplemented. A couple of particular times that it's important if you're doing IVF, and especially if you're doing IVF where you are downregulated. So you're taking hormones like leuprolide that suppress your own hormone production. I think it is standard of care. I know it's standard of care everywhere that IVF is done is to take some kind of progesterone. And a study that actually won the prize paper at our professional organization a year or two ago found that progesterone and oil in the patients that they studied was superior to the other types of progesterone. So it is important to help stabilize the lining of your uterus and to help you maintain a pregnancy. What other questions, Craig?
Awesome. Thank you very much for that. So this question is just more about getting, I guess, your level set for your expectations. And the question here is, how long will I actually end up being on progesterone and oil throughout the course of my cycle?
Great question with a long answer. Kind of the potted version answer would be as long as your provider recommends it. There is lots of disparities between what we recommend, what various programs recommend. Part of it depends on your particular treatment, and part of it depends on what your provider thinks is the right thing for you. Certainly, if you're having a frozen embryo transfer or you're using donor eggs and need to take progesterone, your body's not going to make any progesterone because you've been primed with estrogen and you got to have the progesterone there. Most people will say a minimum, if you're using donor eggs or a frozen embryo transfer, most people say a minimum of 9 weeks gestation, which will be about 7 weeks of injections. And if you're using your own eggs and you're having a fresh cycle, most people will say at least until you have a heartbeat, but some people continue it through the first trimester. If you need to take it for a longer period of time, sometimes your provider, once you do see a heartbeat or it gets a little bit further into the pregnancy, they can switch it over to a vaginal preparation. Very provider specific. We all have reasons we think one formulation is better than another. So talk to your provider about it, especially if you have concerns about it, or if you are having any side effects or irritation from taking the progesterone. Sometimes it can be substituted for something else. I think the most important time, personally, your provider may think differently, that you take progesterone and oil is right after the retrieval. Most people started a day or two after the retrieval, up until at least you have a pregnancy test, but probably a heartbeat. Um, so I would say you will likely take progesterone if you're doing a fresh cycle for at least 4 weeks. So from the retrieval until a heartbeat is seen, but as long as for the first trimester. That might be a conversation you want to have with your provider up front before you even have your egg retrieval, just to have realistic expectations. It helps to know if you can have a countdown to the celebration for all of these medications, not just progesterone. What else you got, Craig?
No, and then just to add too, I think a lot of times one of the things that we hear, and I know you've mentioned it before right here on the show, that the good thing is that you're on it for, yes, you're on it for an extended period of time, but you're on it during a very good part of the cycle where you are working towards that pregnancy, the thing that you've been kind of struggling to get to. So the whole beauty is we're getting closer towards the end of that journey. And so it's a positive thing because that means things have gone well and you're moving to that point where hoping, like you mentioned, Karen, to have that, hear that heartbeat. So it's kind of like the light at the end of the tunnel. So it's a good way to look at it. There is a positive aspect to that. So just wanted to point that out. And so, but that's a great question and excellent answer. Thank you so much, Karen.
Certainly.
So this question we've seen a bunch of times, and I know you've also answered this, but this is also comes up just because of the intramuscular nature of this. Less on the idea that, okay, like I've heard about side effects or I'm worried it might hurt or anything like that. But this is just more around the nerves around it, just being intramuscular as a different type of shot and worrying that you might not do it right. And so in this specific case, the question says, let's see, is there a risk of not giving an intramuscular shot correctly? Can that cause a problem for me and or my cycle? What if I miss the muscle?
Great questions. All medications can be, most of them are pretty generous about a little room for error. With progesterone and oil, to have the fewest side effects and make it the easiest for you is to make sure it gets into the muscle. So if you have an 1.5 inch needle and you put it all the way in till you can't see the needle anymore, and then administer the injection, it is most likely going to be in the muscle. That's why it's a deep intramuscular injection. The time that I see patients have problems, and I do occasionally see patients have lumps or bumps or redness, irritation, tenderness, and sometimes some swelling. The times I see that are when patients, friends or family members or spouse or partner is given their injections and they think, you know what, I love my person more than anybody else loves their person. So this 1.5 inch needle, I'm just going to put it in a 1/2 inch and give the medication. Those are the patients that have problems. So I tell my patients that whoever's going to give your injections, that they love you most if they can put the whole needle in to make sure it gets into the muscle. Again, your provider would be happy to draw targets. Most people I know do it automatically, but if they don't, be sure and ask for it. Ask your nurse to do it, to draw a little circle exactly where the injections need to be given, or refer back to this video where I show you on the little graphic exactly where to give them. If you give them right where you need to and get the needle in all the way, it is very unlikely that you're going to have any issues with it. One other thing that I'll tell you that I recommend for my patients, if they have insurance coverage, and sometimes even if they don't, they want to do it, are the Sonera patches. If you go on mymandels.com/PharmAssist, then you will be able to see videos of how those work. But it's a patch like it looks like a big Band-Aid, and the middle part of it warms and numbs the area where you're going to give it. People sometimes just like that as just a little security blanket to make sure that that it's going to be as easy as possible. Some people say, nah, my insurance doesn't cover it. I'd rather have a Starbucks coffee every day instead of pay for these patches. So they give it without. People tend to like it, having it, that numbs it and warms it. And it helps just with the thought of giving the injection. That being said, I just had my second COVID shot vaccine a couple of days ago, and I meant to take a Sanera patch because I thought the injection hurt when the medicine went in, and I forgot to take it, but I lived right through it, and that was with a longer needle in my arm. So I think just knowing that whoever is giving your injection wants to do a good job, just like you want them to do a good job. Just try to relax those muscle fibers to loosen up as much as you can. Take your weight off the side that they're going to give it to you in your hip, and they'll put the needle straight in all the way and make sure it goes easily. I think it's fine to use heat after you take one of these injections. Again, that relaxes the muscle fibers so they don't tense up like I think cold would make it do. Put a little heat on it. Put a heating pad or something a few minutes before you do the injection. If you're not going to use the Sanera patch, about 20 or 30 minutes before the injection. And that might offer some comfort for you as well. But I tell you a secret, the vast majority of my patients are so pleasantly surprised that these injections aren't nearly as bad as people make them out to be. I've never personally taken a progesterone injection, but I've given lots of them, and people say all the time, gosh, I can't believe that was it. I really worried that much about this injection. So just do the Benjamin Franklin and just hope for the best and speak it into existence. And I think you'll be really pleasantly surprised too.
Yes, I think one of the great things there is that really the scariest shot's always going to be that first one. And once you get through that, you realize how it's not as difficult as you thought, and it's not as painful or nerve wracking or all those things. It's going to get easier from there. So I think the amount of time that you're on it doesn't really matter so much as just that first shot, because that's the one where you want to make sure you're maybe not 100% confident and you're getting a little nervous and you think, and that's where this program comes in, because whether it's you giving your own shot or you're having, a partner or a friend or somebody else assisting, you can always go back and hightail it over to our website. And as Karen mentioned, just watch, you don't have to watch this entire hour-long video. You can just watch the 3 or 4 minute video we just watched showing you how to do it. So you can literally, with the needle ready to go, watch the video and make sure you know what you're doing, and then, get yourself ready. And so that's one of the things that we always want to remind people, that it's a great program to use, not just now when you are in the comfort and just kind of relaxing and anticipating it, but you can watch it immediately before. And same thing applies actually for the Sanera patch as well. There is a video just for that. So if you decide to go that route, by all means, watch that video and you can check out how that goes and how super easy that is as well. So thank you so much, Karen, for making sure you brought that up as well. And with all that said, it looks like we are all caught up with our questions. So, as of right now, I guess we can give another 30 seconds if anyone has any last questions about any one of the 3 products, but I'll kick it back over to you as we get prepared, Karen, to start to wrap it up for the evening.
Perfect. Thank you so much. So I hope this presentation tonight and seeing these little video clips have given you some encouragement and some confidence about taking your medications. Please know that your healthcare providers, your doctors, your nurses, your pharmacists, the folks at Mandel's are always available for you. We want this to be an easy experience for you too. So I would recommend that you take a look at the videos again just before it's time for you to do your next injection, just to make sure you're nice and comfortable with it. And anytime you have questions, always reach out and ask for help. Also, if you have a friend or family member or a spouse that's going to be giving you the injections, maybe they would want to watch this video too, just to give them that confidence. I think it's actually a pretty powerful thing when partners share in the experience that the patients are going through when they are there to actually give the injections. Sometimes the men feel left out of the whole process because they don't, the women are getting the ultrasounds, the women are getting the blood draws, the women are taking the injections. But when the partners are actually giving the injections, it gives them more involvement, more of a role to play. Nevertheless, whoever you choose or to give your injections, know that you do have support every step along the way. So back to you, Craig. Any other questions?
Yeah, it looks like you did a great job. You answered all of the possible questions that anyone could have about any one of these three products. So credit to
Perfect.
you and being amazing at that. So we appreciate it. And one thing I do just want to throw out there to anyone, if you are watching this on Facebook, please feel free, if you're watching this even on demand, you can put right into the chat, just type in there your thoughts about the program, if you have any feedback for us, as well as a little bit if you want to put in about your background, like if you're a current patient or a prospective patient, you don't have to put in specifics, but just let us know so we get an idea of who's joining us. So that would be great. But with all that said, first off, I just want to say thank you so much, Karen, for everything tonight. Thank you for your time and your expertise. Thank you for all of your great answers, and the little tips and things that you're able to share throughout really makes it feel very comfortable, and we appreciate that so much. This program would be nothing without you coming on and joining with us, so we definitely appreciate that. We want to say thank you to everyone who's joining us from home, whether it's Zoom or Facebook Live, or if you're watching this on demand. Thank you for sharing all of those excellent questions that came in tonight. We truly, truly hope that you're able to learn something tonight from the program. Do not forget that, as we've mentioned multiple times throughout, but they would yell at me if I didn't mention it again, that all of these full virtual learning experiences, or VLEs as we like to call them, are available, as well as those individual product demonstrations. You can find them on demand on our YouTube page, on our Facebook page, and of course, as we've mentioned many times, mymandelspharmacy.com/PharmAssist, where everything is broken down. You can watch the full videos, you can watch the individual videos, you can go through and watch them all in order if you want to binge all of the PharmAssist videos that we have. Feel free. I know in quarantine, people are looking for stuff to watch, so feel free. But with that all said, we look forward to seeing you all again here next Monday night at 7 p.m. Eastern Standard Time for another great program. And the most important thing I can say is not only provide us with feedback, but also share, share, share. If you thought this was a great program, I'm sure you probably know one family member or colleague or friend, maybe somebody you bumped into at Target that's going through a situation like this, that you could share this program with. And that's the best way to get the word out there. So we really, really appreciate that if you could share the program and let people know. And with all that said, thank you so much for joining us. One last time, I want to say thank you so much, Karen. You did an amazing job as always. We look forward to seeing you next time. Thank you to everybody back home for joining us as well, and for all the amazing questions. And have a great night, everybody. We'll see you next Monday.
Thanks, y'all. Stay warm.